On behalf of the Health Ombud and the Office of Health Standards Compliance, I take this opportunity to extend greetings and a warm welcome to everyone in attendance this morning. Our sincere gratitude and appreciation go to all our dignitaries and distinguished guests who have joined us this morning, as I acknowledge the presence of our Gauteng Premier, Honorable Mr. Panyaza Lesufi, Minister of Health, Honorable Dr. Aaron Motsoaledi, Deputy Minister of Health, Honorable Dr. Joe Pahla, Gauteng MEC for Health, Honorable Ms. Nomantu Nkomora Lehuko, the OHSC Vice Chairperson of the Board, Ms. Sizeni Mchunu, the Health Ombud himself, Professor Taule Mukwena. We also have a delegation from the National Department of Health, led by the Acting Director General, Professor Nicholas Crisp, accompanied by the Acting Director General, Deputy Director General of Hospital Services and Human Resources, Dr. Matabo Matebula. From the Gauteng Provincial Department, we have the Acting Head of Gauteng Health, Dr. Darion Barclay, the CEO of Dr. George Mukari Academic Hospital, Dr. Fatuwani Godfrey Mbara. From the private sector, we have the Manager and CEO of Netcare Femina Hospital, Mr. Tau Khomongwe. We also have the Gauteng Provincial Manager of the South African Human Rights Commission, Ms. Zamantungwa Mpegi. Indeed, we also have in our midst the members of the affected families, as we acknowledge the presence of the Mushamme and the Masoka family, the officials from the Office of the Health Ombud, members of the media, and all of those that have joined us in the virtual platforms. Thank you all for joining us this morning at this very important briefing, during which the Health Ombud, Professor Mukwena, will share findings of the investigations of incidences that occurred in two hospitals, one in the public sector, one in the private sector. Your presence this morning reflects not only your individual commitment to accountability, but further reflects the shared commitment to transparency and integrity in ensuring the safety of every healthcare user in our hospitals. Ladies and gentlemen, let us recall that behind every report, every finding, every recommendation made by the Health Ombud, there are affected families, loved ones, and our communities that we all owe our profound and collective sense of responsibility towards ensuring that our health system upholds the dignity, safety, and rights of every person who enters any health facility in our country. This engagement should be viewed to be more about learning from failures and restoring trust in our health system, and most importantly, to do whatever it takes to ascertain that such mishaps are not repeated in our health system. The Health Ombud, as you've heard, will release 2 investigations reports which of incidences of a tragic loss of a mental health care user at George Mukari Academic Hospital and a neonatal death at Netcare Femina Hospital. These reports represent a culmination of independent, thorough investigations that seek to identify systemic gaps and outline actionable recommendations aimed at preventing similar occurrences in the future. To the Health Ombud and the Office of Health Standard Compliance, this briefing to us is more than a statutory mandate, but rather a critical moment for transparency, reflection, and action. It is an opportunity to reaffirm our commitment to enhancing patient safety and improving the quality of care in every health establishment. The OHSC will work with all the institutions that are affected, the authorities, and all stakeholders involved in these 2 reports to ensure that the recommendations and corrective measures are implemented. As a regulatory entity for safety and quality of services and the Health Ombud, we remain resolutely committed to protecting the safety and well-being of all health service users. Together, let us transform these lessons from these reports into lasting improvements that saves lives. Ladies and gentlemen, it is my honor to graciously invite Professor Taule Mokoena to ascend the podium for the official release of the findings of the two reports. Over to you, Prof.
Thank you very much to the CEO and also the program director. And may I also extend a good morning to the rest of you here present. In particular, I would like to recognize the Minister of Health, Dr. Aaron Motsoaledi, his deputy, Dr. Joe Pasha, the Premier of Gauteng, Mr. Panyaza Lesufi, the MEC, Ms. Norman Tunkomol Ralehoku, and the Vice Chairperson of the OHSC, and everybody else that the CEO has recognized, but in particular the people in charge of the institutions that we investigated. These two findings, that the finding of the two investigations, they are important in that in their different ways, they illustrate some of the lapses of safety of patients in our public and private sectors. As you've been told, the report, one of the reports concerns the death of a psychiatric patient at George Mukhari Academic Hospital, and the other one, the death of a neonate at the Netcare Femina Hospitals. It is the responsibility of the Health Ombud to uncover the truth and ensure accountability, and above all, to drive improvements to protect patients across our healthcare system. These reports were conducted in line with Section 81A of the National Health Amendment Act, which empowers the Health Ombud to receive, consider, investigate, and dispose of complaints relating to non-compliance with norms and standards in a fair, impartial, expeditious manner. Above all, the Health Ombud may undertake investigations on his own initiative. We shall start with the case of the psychiatric patient that died at the George Mukhari Hospital. Before I do this, let me acknowledge the principal investigators that assisted with this investigation, namely Joyce Munyela and Douglas Mapeto. The investigation was undertaken following a request by the South African Human Rights Commission, asking us to investigate the circumstances under which, the psychiatric patient died of burns at the George Mukhari Hospital. It is the responsibility of the Health Ombud to determine whether the care provided to this individual complied with the Mental Health Care Act, which requires that all mental health care users receive humane, dignified, and least restrictive care. The patient was a 35-year-old woman who was brought to the George Mukhari Hospital by her brother-in-law. And then the woman, as we said, died while still under the care of the George Mukhari Hospital. The key findings are as follows. The investigation identified serious procedural, clinical, and ethical and safety failures or lapses in the care of this patient. Her admission process did not follow the prescribed requirements where two doctors should have independently examined the patient and committed the patient to psychiatric in-hospital treatment. Thus, this lapse actually rendered the admission illegal or invalid. There were mechanical restraints that were applied to this patient in excess of the requirements that are required by the national policy. She gave a history of alleged sexual assault, but the hospital did not appropriately assess, document, or report this incident to the police as is required by law. The prescribed medicines were deliberately withheld as a form of punishment. However, the medical records were falsified to indicate that the treatment was administered. The patient was denied food, again as a form of punishment, while she was in seclusion. The required safety procedures were not followed during this seclusion process. The seclusion room was poorly located, being very far from the nurse's station, and lacked adequate monitoring systems or devices. Safety fire concerns were raised by one of the other patients in the unit, but these were dismissed by the nursing staff. The patient was not thoroughly searched before she was committed into the seclusion room. Thus, the patient had a cigarette lighter on her person, which most probably was used to start the fire. There were critical delays in accessing the seclusion room when the fire broke out. Emergency exits were locked, and the keys were misplaced or hidden. Excuse me. Disaster preparedness systems were inadequate. The mattresses that are used in the psychiatric unit were not flame resistant or fire retardant, thus allowing fire to ignite readily and spread. The postmortem of the patient later demonstrated that she was alive when the fire broke out. As a result, there was evidence of upper respiratory tract burn injuries. And more importantly, her carbon monoxide levels in the blood were raised. The investigation therefore uncovered systemic violations of the rights of mental health care users, including the use of punitive practices, inadequate infrastructure, inadequate staffing, and insufficient staff knowledge about the Mental Health Act, which directs health professionals about their conduct in managing patients. The findings also pointed out systemic weaknesses and failures in governance and oversight overall. We make the following recommendations. First of all, that these recommendations are directed to the hospital, to the Gauteng Provincial Department of Health, professional regulatory bodies, and other oversight structures. And these are the strengthening of compliance with the Mental Health Act, as we have already indicated, improving the infrastructure, ensuring proper staff training, enforcing requirements for reporting abuse, and establishing and enhancing governance structures and mechanisms at all levels within the hospitals, and indeed in the psychiatric unit in particular. Protecting the dignity, safety, and the rights of mental health care users is not an option. It is a constitutional and legislative imperative. Above all, enhancing patient safety systems in the hospital and in the psychiatric units in particular is of paramount importance. Instituting appropriate disciplinary and professional accountability processes on the implicated professionals. Therefore, the Health Professions Council of South Africa, the Nursing Council, will be requested to consider the findings and initiate appropriate professional conduct inquiries on the implicated health professionals. George Mukhari Hospital must procure certified fireproof mattresses. The psychiatric unit is currently not fit for purpose, and it is imperative that it must be refurbished. Indeed, the whole hospital needs to be refurbished, if not rebuilt. I'm glad that the minister already in Parliament included this hospital among the 4 or 5 other central hospitals that are due to be upgraded or refurbished. The Health Ombud will continue to monitor the implementation of these recommendations. And lastly, would like to extend our sincere condolences to the Muhlame family for their loss. And her death is not only a personal tragedy to them, but it is also a profound reminder of the responsibility that we carry to protect the most vulnerable among us. Now I shall turn to the other investigation, which is the death of the neonate at the Netcare Femina Hospital. The investigation was started by a complaint that was lodged by the mother of the neonate, Moatlegi Masuka, who allegedly died from incorrect medication that the neonate received at the neonatal intensive care of the hospital. I should, in this instance, acknowledge the assistance that the Ombudsman was given by Ms. Maritapo Masemula in the investigation of this particular patient, or rather case. The investigation found critical errors that occurred when the adrenaline was administered intravenously instead of by nebulization as a result of the incorrect prescription route and poor communication between and among the healthcare professionals. We found weaknesses in the safety of medication system. There was poor communication, as I said, between and among the health professionals. There was poor governance and oversight within the neonatal intensive care unit at the hospital. There was failure of the hospital to refer the unnatural death or the death from healthcare procedure or intervention for forensic postmortem as required by law. Additional risks were identified, namely, there were outdated medical protocols, there was insufficient takeover, shift handover procedures, and there was weaknesses in the electrical medical record access control. Maybe I should explain what this means, is that the hospital has got, is working without paper records. It uses electronic systems. But each person, each user is assigned a unique password. However, this was not sufficiently enforced, such that the staff swapped the passwords among themselves, and then, which means that they could enter wrong entries. Let me not say wrong. They could enter entries under somebody else's name, and therefore it was difficult to trace who actually did do whatever was inconsistent with practice. Now, we recommend that the hospital group should implement corrective measures, including strengthening medication verification processes, updating the protocols, improving supervision and training of both medical and nursing staff, enhance the electronic system controls by debarring exchange of passwords between staff. The relevant health professionals will also be referred to the professional regulatory councils, such as the Health Professions Council and the Nursing Council. The hospital must undertake further mediation with the Masoka family. The Health Ombud, through the Office of the Health Standards Compliance, will closely monitor the implementation of all the recommendations to ensure that the relevant health establishments take meaningful corrective actions. We wish to also extend our sincere condolences to the Masoka family. In closing, the two investigations, though different in context, they share a common message, which is that patient safety must be guarded and enforced at all times. It must be built into the system with appropriate leadership, proper staff training, and accountability at every level of care. Thank you very much.
Thank you so much, Prof, for releasing the findings of these two reports. We are now going to hand over the reports to the Minister of Health and also to the Premier of Gauteng, OHSC Vice Chairperson, Ms. Sizeni Mqunu, and also the CEO of Dr. George Mukari Academic Hospital, Dr. Fatuani Godfrey Mbara. And then after that, we'll also hand over the other report for Netcare Femina Hospital to the CEO, which is Mr. Tau Homungwe, and then also to the representative of Netcare Femina Hospital, Ms. Masuka.
One at a time.
One at a time, yes. The first one will be to the Minister, Dr. Aaron Mutsaledi. This one's to the Minister. To the Premier. To the OGC person. To the CEO of Dr. Johannesburg Hospital. Mutame family. We're now going to hand over to the CEO of Netcare Femina Hospital. Also to the Masuka family. Thank you so much for handing over the reports to all the parties. Without wasting much time, I'm now going to invite to the podium the Honorable Premier of Gauteng, Mr. Panyaza Lesufi, Member of Provincial Legislature. Thank you.
Thanks so much, Program Director. Truly appreciate it. Let me acknowledge and thank the Health Ombud, Professor Taule Mukwena, and your deputy. Let me acknowledge the Muhlamme and Masuka families. Acknowledge the Minister of Health, Honorable Dr. Aaron Mutsaledi, and the Deputy Minister of Health. Let me acknowledge the MEC responsible for health in our province, Ms. Nomantunko Moraluhuku, together with the Vice Chairperson of the Ombuds Office, Ms. Zeni Mkuno, the CEO, Dr. Spiwe Ndaweni, the officials that are representing Dr. George Mukari Academic Hospital, as well as the officials from both the national and provincial departments of health, together with the Netcare group officials. Members of the media, fellow South Africans. We come here obviously deeply hurt and disappointed with the outcome that has just been released by the Office of the Ombud. It is quite clear that there are lots of things that still need to be improved in the health system. But ever since the report the draft report was made available to us, we moved with lightning speed to ensure that we rectify what has been established. But before I go further, let me also add my voice and the voice of the Gauteng government in extending our sincere condolences to the Mhlamme family. I think Prof captured the essence of how we feel when we release this kind of reports to society. Even though the other families from Netcare, we also want to extend our sincere condolences to the Masuka family as well. When the report was presented to us, it was quite clear from the report itself that there are areas that we need to move with lightning speed to improve within the healthcare system. But where we are, we want to put aside excuses. We want to put aside matters that won't assist us and concentrate at the task at hand. So we deeply regret and take full responsibility for the failures that have been identified by the Office of the Ombuds, especially the rights of mental care users in our institutions, including the unfortunate use of punitive practices, inadequate infrastructure, inadequate staffing, and insufficient staff knowledge in terms of the Mental Health Care Act needs. So we have no intention to disguise our disappointment, but also we have no intention to put excuses forward. As I indicated, immediately when the draft report and the matter was reported to us for immediate action, together with the Department of Health, we immediately went on an overdrive to rectify the situation and to ensure that this kind of incident don't occur within our institution. The first task, as per the recommendations, of which I must say Prof. Mokoena, as a Gauteng department, to accept fully all your recommendations. And we've put up the systems to ensure that we update you on all the actions that we are taking, that we have taken, so that we can continue to monitor our performance on this matter. So today is not just to receive the report, but is to give an update of the work that we have done thus far. The first one is the additional capacity. We have moved the capacity. When the incident happened, there were only 3 specialized psychiatrists. To date, we have increased that from 3 to 8. We've also put additional 12 nurses to the total of 105 nurses that are dealing with this particular task. You will see from the report that the reporting processes and the security establishment was non-existent. We have now assigned 9 permanent securities that are now stationed permanently, so that an incident of this nature, when it happens, the securities are the first people to attend to this matter. We have strengthened in supervision so that those that are tasked with this kind of work, they can be properly trained and be capacitated. Of those that needed to be trained, we've now trained 21 nurses, and we've also trained 2 social workers so that they can understand the responsibilities that have been identified in this particular report. We've also installed additional CCTV cameras so that the security guards can monitor what is happening immediately. We've put all the fire remedial projects. Others are still on course, but those that we have concluded, on the 19th of February, we received the certificate of fire compliance, meaning that the hospital now is fire compliant, even though there are still other outstanding matters that need our immediate attention. What we still need to do, which is very important, is the mattresses and many other things that have been identified in this particular report, which are areas that we believe will assist us to ensure that we fully comply with this report. As we stand here today, we don't want excuses. We want those that have been identified by this report to be handed over to the MEC responsible for this portfolio so that appropriate action can be taken. We also want to learn from this incident and ensure that all our hospitals comply instantly with the recommendations that are contained here. The recommendations here might be about one hospital because we don't want the reoccurrence. We're expanding the recommendations to mean all hospitals. In summary, Prof. Mokoena, we are of the view that we have learned from your findings. We are of the view, as a department, we take full responsibility, and it doesn't end there. We have to ensure that we stop these incidents from happening in our hospital. Once more, we want to thank you and appreciate your support, and be assured of our support as the provincial government, and will continue to work and cooperate with your findings, whether good or bad. To us, your office represents a very important institution in our country that we need to protect and cooperate. Thank you so much.
Thank you, Honorable Premier. I'm now going to invite the Honorable Minister of Health, Member of Parliament, Dr. Aaron Muzaledi, to the podium. Over to you, Minister.
Thank you very much, Program Director. Let me say protocol is well established there. I also wish to extend my deepest heartfelt condolences to the Masuka and Mothambe family. As the Premier has already said, losing one person is one person too many. And Professor Mokoena, we accept your recommendations, and as always, we will say the Ombud has done the work for which he was chosen for, he was appointed for. I've already said many times that because South Africa never had a health Ombud, when we established this office, people were asking us what a health Ombud is, and I always said it's the public protector of health. So I must confirm, Prof, that you are going on with your work to protect the healthcare system of the country, both public and private. And we are happy that you are continuing along the same lines that your predecessor, Professor Malagapuru Makhoba, did, that all health Ombud we have had in the country are doing their work without any favor or prejudice. Thank you very much. But Prof, you have mentioned something about training. Even in the last report of Northern Cape, you also mentioned training. But I noticed something in both reports, both George Mukari and the Netcare Femina Hospital, that a cornerstone of medical ethics has been breached. I do not deny the fact that people need training. In fact, after life is demanding, we have started this training when the then health Ombud, Professor Malagapuru Makhoba, noted that mental health review boards are not being given the seriousness they deserve, that many people don't even know that they are quasi-judicial structures. They are not just structures. When you deal with mental health people, you need a quasi-judicial structure. That means a structure that has got powers that falls just beneath a magistrate or a judge. They are the ones who decide on mental health users. And I'm disappointed, Prof, that you found that the admission of the Mothambe patient was not even going according to that protocol. We've emphasized it. Even last month, when we had the National Health Council, where the minister meets with all the provinces, the military health, South African military health services, even SALGA. We put this on the agenda to check province by province how many people in the mental health review board are there, whether they comply with the legislation. We did that even last month, and it's quite disappointing that we're still having these problems, but we'll keep on training. But I want to say, Prof, a cornerstone of medical ethics has been breached, because when we hire doctors and nurses and other professionals, we don't pick them from the street. They come with qualifications. They come with training. And the principle here, which has universally been breached by both George Mukhari Academic Hospital and Netcare Femina, is the principle called primum non nocere, meaning first do no harm. That's the basic principle that every health worker is taught. Primum non nocere, first do no harm. When you help a patient, that's the meaning of the principle. It implies that dealing with a patient, if intervention might cause more harm than good, then it's better not to do anything. So when you interfere, the first thing you must put into mind is that I must not do harm to this particular patient. That's the principle which is taught around the whole world, in every medical school and every nursing college. But after that principle, you also take an oath. There's a Hippocratic oath. This principle of primum non nocere, it actually precedes the Hippocratic oath. By the time doctors started taking a Hippocratic oath, the principle of primum non nocere was already there. Please first do no harm. And in this case, it means that principle was thrown out of the window. That's very unfortunate, but as we say, we'll take, Prof, your recommendations. Professional bodies like the Health Professions Council of South Africa and the South African Nursing Council were established specifically for this, to keep on reminding health professionals that you are under oath and you must protect your patient at all costs. The second part of this, Prof, the issue of infrastructure. It is true, we accept fully the lack of infrastructure at George Mukhari Academic Hospital. And many of you in the media, because you did cover the event, you'll remember that we even insisted that the president must go to George Mukhari Academic Hospital, which he did a few days before the State of the Nation address, because I wanted him to see exactly what we're talking about. And the Premier was there, the MEC was there, and the President saw. And during the State of the Nation, he mentioned the hospitals that must be built, because we gave him 11 dossiers of 11 different hospitals that must be put up. And I'm happy that the Minister of Finance then reciprocated by establishing what they call a BFI, Budget Facility, Budget Infrastructure Facility, so that those hospitals must be built, because in our budget we don't have money. And all 11 hospitals, we have started at the National Office the process of applying for that BFI, so that we put these academic hospitals. George Mukhari was #1 on the list. That's the one that we are really looking at, because it's a training institution. It does not only cause problems with what has happened to the Mutlammes, it also causes problems to the training of medical students. So we are going to try our best to make sure that we start as soon as possible to build. I personally regret the fact that we actually started as far back as 2014, talking to the PIC, specifically to help build George Mukhari Academic Hospital, King Edward, the hospital which is now Victoria Mkenge in eThekwini, and Nelson Mandela Academic Hospital in Mthatha. We started in 2014. I remember we were very unfortunate. On the day we were supposed to finalize with the PIC, a DDG from Treasury came and scuttled the same whole thing, put lots of technicalities, and the process fell off. We are now here where we are, so many years later, that we have got to start from the scratch, but better late than never. And we are going to make sure, Health Ombud, we hope also with your push, to push the powers that be, that look what this has led to. Because George Mukhari Academic Hospital was established 50 years ago. It was never built. I don't want to get into deep politics, but this is a fact. If you check all the medical schools that were established to train white medical students, you can go to Grooteskier, Tygerberg, universities in Freestad, you can go to Charlotte Maxeke in Johannesburg, and Steve Biko here in Pretoria. You can all over, you'll find that they built a medical school and a hospital. Only in 1953, when the first black medical school was established, that is the Natal Medical School where I studied, only in 1953. The process of ignoring to build hospitals started, whereby you just choose very small district hospitals and saying that's a training for medical students. That happened in 1953. Unfortunately, it was repeated 20 years later when Medunsa was built. The same process was followed because they were now building for blacks. And 15 years after that, same process was followed when Walter Sisulu University in Tata was followed. It was nearly repeated when a new medical school was established in Limpopo. It was nearly repeated. And there I remember the fisticuffs when I went to Treasury and say, this is no longer going to be allowed. Not in a democratic South Africa, it can't be allowed. And that's why last week when I visited Polokwane, I also went to investigate the academic hospital, Premier. The ruling was that we need to go and renovate the old Petersburg Hospital. And I refused and said, no, it's not going to happen again after 70 years. Same thing happening to black people. So we are putting up a state-of-the-art academic hospital in Limpopo, which will be open the middle of 2028 to try and avoid problems like this. And I'm happy that it's 20%, 40% completed. We like to do the same for George Mukhari. And I was telling them last week in Limpopo, the miracle that they've done in Mankweng Hospital, which is not an academic hospital. It's written there at the entrance, academic hospital. I said, this is just a wish, because academic hospitals are specifically designed for that purpose. But I said the fact that they could do such a miracle shows if we put up good structures, many more good things will happen, Premier. I don't want to blame that much the clinical acumen of staff at George Mukhari Academic Hospital. They are one of our prime training institutions, Prof. So it's not the lack of clinical knowledge of the professors and the clinical staff there, but the fact that they did not have good facilities. By so doing, Premier, I am not forgiving the fact that primum non nocere was thrown out of the window, which is a basic training principle for any healthcare worker. So we'll make sure that people know that every day when they go to work. Thank you very much.
Thank you, Minister, for those remarks. Ladies and gentlemen, we are now going to open the floor for questions, and our principal will also provide those answers after the questions. Also, it is important that you mention your name and also the institution that you are representing when you ask the question. The floor is now officially open. Questions? Yes, there is one.
Hi.
Yeah, can you just...
Okay. My name is Naomi Kobe from Premier and Minister, we've heard the recommendations set out here. I suppose what assurances, especially the families, do they have that action and accountability will be taken, especially involving the staff? Because we've spoken about infrastructure, but what about these staff who are directly implicated here?
Thank you so much for the question, ENCA. Immediately when, as I said, we received the draft report, because normally that's what how the office works, we asked the department to set up the necessary processes. And you'll see from the reports there are other institutions that are fully empowered by law to take specific actions, and they're contained in the report. So we'll monitor that and cooperate with those institutions so that they assist us. But where the institutions can't go, I think as a department, the MEC, I said to her, she's empowered to take those actions. And I share the frustration and the pain of the families, that there are specific individuals identified, and therefore we must not leave these matters unattended. And the minister have correctly captured the essence of missing those kind of actions. But from the practical solutions as a department, because this assists us to avoid this kind of incident happening across our medical institutions. For example, the affected ward in George Mukari, we had to overhaul that ward completely as part of the actions that we have. So there's a new ward now compared to the ward that when the incident happened. The minister is assisting us, and thank you, Minister, is assisting us to decant that hospital. It's overcrowded. I mean, it's a fact. So a land has been identified jointly with the university. The minister has just identified the infrastructure funding that is possibly coming, which is a private-public partnership, to say they can advance funds to us. And we are high on the list of the priority hospitals the minister feels that need to be improved. We believe that's an action that will demonstrate our willingness to remedy the situation. And we remain focused in monitoring the situation across all our hospitals. And to me, that's very important. I said to the MEC, I don't want to come here on George Mukari. Tomorrow I'm coming on Charlotte Maxey. The following week I'm coming on another hospital. Let this be the basis and the barometer for us to intervene and prioritize areas that we need to prioritize. And the mere fact that now we've got the fire compliant, there are lots of OHS issues that are contained in this report that need our immediate attention and support and budgeting. We're proud that both the Department of Health and Department of Education received the highest chunk of our budget. So this is the area that we prioritized. It might not be enough, but at least the political will to ensure that we don't have this kind of problems in our institutions is there. And as a leader of these institutions, I regret, without any form of reservations, that we have to sit in this kind of meetings to deal with issues that must be basic in our health systems, that these things must not happen. And as a leader of the institution, I can't continue to point fingers. I need to act. And that is why I said, MEC, act on these issues, allow the institutions that are empowered to act on others. When we find the reports and update the ombuds, if those actions are not sufficient, we have no choice but to intervene at that stage. Thanks.
Yeah, thank you very much, ENCA. Yes, we can assure that the recommendations will be implemented. We always do so. Not only do we implement them, we are required by law to report progress to the health ombud. He does also demand progress because he doesn't just issue these things and go away. He wants to make sure that something has been done. So definitely it's going to be done. But we also won't stop going to the professional bodies Because while I spoke about lack of infrastructure and all the other things, refusing, withholding food for no one, I mean for somebody, has got nothing to do with infrastructure. It's got nothing to do with lack of training. It's just outright inhuman for any person who's taking care of anybody. Even if you were to take somebody who is not trained as a nurse, they know that especially for mental health care users and for patients, you can't withhold food. Punishing somebody but withholding medicine is also a cardinal sin. I wouldn't know what your health professionals will be. What problem are you resolving by holding medicine to somebody who came there to receive medicine? So all these things will have to go to the respective professional bodies, and we will insist that they do something about it. Lastly, for those who believe, the Act actually gives people all the chances. For those who believe that the Ombud might have gone wrong, the Act itself, when we designed it, was such that people can take the report on review. And in the Act, the review, after somebody applies for it and say, I think the Ombud is being unfair to me, the minister must then establish a tribunal that must be chaired by a retired judge or a magistrate, helped by two health professionals. We usually choose professors. In the case of mental health, we will choose professors of psychiatry and any other professor of medicine. In the case of the child who died at Netcare Femina, obviously we'll get the pediatric professor. If somebody in that Netcare Femina hospital believe the Ombud was very wrong, it's not true, and all that, then they will apply for that review. And I'll put together a tribunal, and the tribunal will listen to their stories and make a ruling. Many of you might have forgotten. It actually happened after life is the main. There are many people who wanted to take the Ombud's report on review, and I appointed the former judge president of Gauteng, Judge Mwebe. I appointed him together with a professor of psychiatry from University of Cape Town and the late well-known health activist and professor of pediatrics from the University of Natal, Professor Jerry Kovadia. They are the ones who said and reviewed whether the Ombud took the correct steps. And of course, they said so, that everything was done according to the Act. There's nothing wrong with the findings. And that's why the process of taking over the people who were implicated, it went on after that review. Even with the recent report, Prof, of the mental health problem in Northern Cape, yes, even with that problem, there is a review application that some of the staff members who were found guilty believe the Ombud was wrong. I put up that tribunal. Unfortunately, the judge who was heading the tribunal had other problems, and after some time, we had to start all over again, and I think that process is on. So people always take issues on review, but the fact that they were found guilty doesn't mean we'll stop doing what we have to do until such time that a retired judge or magistrate passes a verdict that there's something wrong with the health Ombud report. As long as there's nothing like that, we will take appropriate action and report to the Ombud. Thank you very much.
Thank you so much to the Honorable Premier and also to the Honorable Minister. I was told that even online we don't have further questions. I'm now going to hand over to invite to the Vice Chairperson of the Office of Health Standard Compliance, Mayor Sinzeni Mchunu, to give us the vote of thanks and closure. Thank you too.
Program Director, Mr. Mahlakanya. As we draw this important briefing to a close, please allow me, on behalf of the Office of Health Standards Compliance, to express my sincere appreciation to all for your presence, your engagement, and your commitment to strengthen accountability within our health system. Today has been a sobering reminder of the consequences we bear when the system fails those it is meant to protect. This is a reflection of a tragic loss of a mental health care user at Dr. George Mukhari Academic Hospital, and the neonate that died at Netcare Femina Hospital. Colleagues, these are not mere cases. They are lives that we have lost in places where care, safety, and dignity should have been guaranteed. The findings presented here are not simply procedural outcomes. They speak to real families, as we have seen, real suffering, and systemic gaps that must be addressed with urgency and resolve. To the families and the loved ones who have suffered these tragic losses, we once again extend our deepest condolences. We acknowledge your pain. And we reaffirm our commitment that the findings released today will lead to a meaningful and sustained action. This moment must not end with this briefing. It must be the beginning of real change. The recommendations arising from the Health Ombud's investigations require more than acknowledgement. They demand implementation, oversight, and accountability at every level of the health system. As the board of the Office of Health Standards Compliance, we will ensure that these processes are rigorously monitored and that there is a clear follow-through on all required corrective actions. We are equally mindful that building a safer health system requires more than compliance. It requires a culture shift, a culture that prioritizes patient care, values of transparency, a culture that encourages the reporting of concerns, and a culture to learn continuously from our failures. In this regard, we call on all stakeholders, healthcare leaders, professionals, regulators, and policymakers to work collaboratively to strengthen governance, improve clinical oversight, and embed a culture of quality and safety across both public and private sectors. The credibility of our health system depends not only on how we respond to the failures, but on how effectively we prevent them. Let us therefore move forward with a shared sense of purpose to honor the lives that we have lost, to restore public trust, and to ensure that every person that enters a health facility in South Africa can do so with the confidence in the care they will receive. I thank the Health Ombud and his team for a very thorough and independent report. I also thank the presence of the Minister and Deputy Minister, Dr. Mtswaledi and Dr. Patla, respectively, the Premier of Gauteng, Mr. Lesufi, and Gauteng MEC, Ms. Nomantu Nkomo Ralihoku. I thank you one and all. Thank you, Program Director.